Hi there, welcome back. Today I want to talk about something that I have found really impactful in my own grief journey. And it's important, I think, for everyone who's a grieving mom. EMDR, eye movement desensitization and reprocessing, is a relatively new therapy for those who have experienced traumatic events. The goal of the therapy is to help rewire your brain and allow the patient to relieve stress and face what has happened to them. So this is how it works simply. Imagine that I'm the therapist. I ask you to talk about your traumatic event, and then I hold my finger and move it side to side, or I ask you to tap like this. Your goal is to track my finger or just pay attention to bilateral touch. Now, I'm not a therapist. I'm not a scientist. I'm not a practitioner of EMDR, but I know that EMDR works. And there's a lot more that I could tell you, but I'm not going to because I'm not the expert. But memory disturbances, rumination of grief, concentration difficulties, feeling like you're back at the exact moment of when you heard the news of the death, all of those things can be helped by EMDR. The rut that you may have been in, it's not entirely your fault. Through the correct practices of EMDR, you can learn to better process grief and take care of yourself in new and different ways. So if you're struggling and you feel stuck, and I don't know who isn't when they're a grieving mom, I urge you to seek a licensed therapist and ask them about EMDR. Ask them to help you find ways to help you process your grief in a healthy way. It has helped me and it may help you. Now, I just want to add a couple of things. I believe that any woman that has lost a child or a grandchild is absolutely in complicated grief. And most of the time, especially if the circumstances have been tragic or sudden, you are going to be experiencing PTSD. Now, EMDR is really beneficial with PTSD. It's used a lot with excellent results with war veterans. So I just want to urge you that EMDR is definitely something for you to look into. And I'd love to tell you more about it, but as I said, I'm not the expert. So please consider it, think about it, talk to your therapist about it, and we'll see you back soon. Thanks so much.